Hi, I've got Dr. Bridget Casey here. Dr. Casey, why don't you tell me a little bit about yourself?
Sure. So I'm a naturopathic physician. I own a clinic in Rhode Island called Rhode Island Natural Medicine. I've been practicing here for about 8 years or so now. And prior to that, I was practicing in Virginia, where I also completed my residency in naturopathic family practice. I currently focus on seeing women for fertility and their partners as well. So I focus a lot on women's health and hormones, but I do a lot also with gut health and immune balance and things of that nature. So yeah, right now I have a solo practice in Rhode Island that's quite busy, but treating me well. And I've been enjoying this work for a little over 10 years or so now.
That-
So when I moved to Rhode Island and opened my own practice, I was coming from more of a large clinic that had a lot of support staff and things like that, where as practitioners, we were just kind of focused on seeing patients. But now, as the business owner, I had to think a little bit more about overhead and how to sort of streamline things and make it um, make sense financially, but also kind of ease of use and like my time and what I want to focus on. When I started my business here, I found a couple tools that have been super helpful for me. One being Intake Queue, which you mentioned, just sort of my online systems. But then holistic practice management is how we work with patients calling the office. So I have two dedicated women who've been answering the phone for me for about 8 years who are wonderful. And it's really been super helpful for me because I don't have to basically pay a full-time front desk staff to do that. So it saves me a lot in overhead and I just can utilize them sort of as needed and sort of get billed for time spent. So it's a really nice sort of, I guess, pay as you go model that's been helpful for me where when people call the clinic, there's someone answering the phone who understands what I do, understands naturopathic medicine, which is a unique form of medical practice, of course. So it's important to have someone be able to answer basic questions about how we work and what I specifically do. Like I mentioned, I have some areas of focus. So to be able to talk a little bit about that and help me manage the wait list and onboarding new patients and things like that. It's been super helpful for me to have tools that work specifically with the type of medicine I'm practicing, but also help keep overhead down and keep me running a successful business in a sense of like cost and expenses and so forth.
You mentioned that you had a past career in business and that you sometimes give business advice to colleagues, especially talking about maintaining, financial balance in practice. So talk about how your experience sort of ties in with your use of HPM.
Sure. So my background prior to becoming a naturopathic doctor was in marketing and advertising. Was working with certainly, hefty brand budgets and things like that. But just because of that, I think I have an eye towards understanding business a bit. And being a business owner has worked well for me. But I think unfortunately, a lot of medical professionals have a hard time running a successful practice. Sometimes we're really good at treating patients and doing what we went to school to do in that sense. But a lot of folks might have difficulty with the financial and sort of business end of running a practice. So for me, I have a bit of a lens for that just based on my background and how I think. So I think it's important, especially as I mentioned, to find ways to keep your expenses down. I think is a really important piece that gets overlooked. And when you're when you're first starting a business, right? We don't expect to be profitable for those, first 6 months or so often. How are you going to keep expenses down so that you can, again, keep your lights on, keep your practice running, be able to see patients and do what it is that you're really here to do? So for me, I think it's just a matter of, when I first started out, I was thinking a lot about certainly marketing with my background and having people know about your business and learn about you and what you offer to sort of get the word out, but also thinking about just like the finances and how to run a business. And I kind of think about it almost like a game. So, how do you keep your expenses down and get your income up in a sense that you can be successful and, be able to be here for the long term, to be able to, again, stick around and be able to keep seeing patients and do what it is that you're here to do and really help people.
There's another thing that really strikes me in our conversation that you're also, aside from being fiscally responsible, you're attention responsible. It seems like you've made this practice work for you in a way that minimizes your cognitive overhead so you can focus on having a better practice, providing a better service, and having a real life so you can be, more present with your patients. Maybe you could talk about that a little.
Sure. Yeah. So I think just in today's world, there's so much distracting us all the time. And so I think part of being a successful naturopathic doctor is really being able to sit with your patients and bring your attention to the visit and really focusing on the person in front of you hearing their story, trying to understand who they are, not just what they're dealing with. So you can figure out how you can guide their healing process in a really specific way. So I think attention is really important thing to think about and focus on as especially a naturopathic doctor. And with that comes how do I minimize distractions, right? So certainly when you're in a room with a patient, that's your main focus. But again, you don't want to have your mind in the background thinking about, oh, again, who's answering my phones, who's returning messages, doing this, that, and the other, like keeping other pieces working for you. So, some of us are better multitaskers than others, but you want to be able to focus, yeah, your time and attention as much as you can on seeing patients. So, where can you offload some of your or delegate some of your other responsibilities when it comes to your business or your practice? And I think things like HPM, again, is a great tool to do that. And I've found a few other tools, I guess I would say, in sort of the technology space that can help that too. But not having to worry about, again, onboarding new patients, for example, is a piece that HPM has really helped with because the women who answer the phone for me are really knowledgeable now about how to explain the process and how to fill out new patient intake forms and all that stuff and kind of get people set up in the system. So that's a whole piece that like I don't need to spend my mental energy on.
You had mentioned that one of the things that sort of meant most to you in your decision to use HPM was your observation that, our team really understands the nuanced and sort of niche nature of naturopathic medicine. You contrasted that with using a virtual assistant service or that kind of thing. What's your thoughts on that?
Yeah, so naturopathic medicine is a small profession. Most people are not familiar with what a naturopathic doctor is or how we practice. So having someone who is answering your phones have an understanding of us and of naturopathic medicine, I think is really important. And being able to answer basic questions and understand, okay, why is a new patient visit, 90 minutes or whatnot versus, people are used to going to the doctor for maybe they're getting 15 minutes with the doctor on a good day. Why do I need to spend so much time when I'm coming in, for example, or what is the doctor doing in that time with me? So just being able to explain, things like that, like this doctor or the naturopathic doctor is really working to get to understand you and who you are as a person and better understand what you're dealing with in terms of your symptoms so we can get to more of the root cause issues takes time and to get attention. So it's pieces like that, right? Like being able to explain why a visit might be longer or why we might see you more frequently than maybe you're used to going to the doctor once a year, but now you've got some chronic health issue what you want to address, making sure you're following up with your naturopath, whatever it is, maybe every 6 weeks or something like that until you're feeling really good and your concerns are addressed, being able to again understand like how this process might differ from more of a conventional approach to medical care. So yeah, having people understand the pieces that differentiate naturopathic doctors is really important because we are we are different, but we're also kind of niche. So not everyone's heard of us. And so sometimes when folks are calling, they kind of have an idea of what they might be looking for. They kind of know they want to work with natural remedies or a more holistic approach, but the sort of ins and outs of how long that might take or how often they may go to the doctor or things like that, they might not have an understanding of yet. So it's important to be able to have people be able to answer those types of questions.
Super. I also remember you mentioning how often patients comment on how sweet and kind your receptionists are, your team are, Debbie and Glenda, in your case, and to the point where some patients were disappointed they couldn't meet them in person. And this feedback means a lot to our team. It reflects the relational side of patient care that's easy to overlook when we're making decisions about infrastructure. What's your thought on that?
Yeah, absolutely. Actually, I just had a new patient yesterday who came in just gushing about Glenda, and she's like, "Oh my gosh, she's so great! Like, you need to hang on to her. She's literally like the best, I guess we call it support staff person I've ever talked to in a medical practice, and it makes me want to keep coming back." She said to me she chose her primary care also based on not just the doctor, but also all the front desk and support staff because she wants to go to a place where she feels like she likes the environment. So it's a perfect example of I hear that with almost all of my patients who come in. They say, "Oh my gosh, your phone ladies," as we've heard them, but Glenda and Deb Lynn are so sweet and just very kind, very understanding. They do a great job. Like I said, I've had them luckily for the whole time I've had my own practice. So yeah, pretty much everyone who comes in is kind of gushing about them and maybe a little disappointed they didn't get to meet them. They're just stuck with me. Yeah, it makes me, just sort of confirms my choice to utilize your business and specifically working with those two women has been really, really helpful.
Right, and there's a lot of research on the fiscal implications of your front desk staff, and so just really happy that we can support you and in your practice. You also mentioned appreciating the continuity of coverage, especially during your maternity leave, or your practice can kind of function smoothly regardless of your patient volume, and your costs were reflective of your volume, not of fixed costs.
Yeah.
What's your thoughts on that?
Yeah, so I was on maternity leave this time last year, actually. And it was, again, nice to not have to worry about if people call the office, what's going to happen. So I still, was paying HPM basically on a per use basis. So my whole practice, everyone who was actively seeing knew I was on leave, but right, we still have calls related to interested new patients. I kept the service going. Of course, we didn't like turn off our phones. So when folks would call, again, they'd be able to get the background information, join the wait list if that made sense for them. And also the cost was much lower because most people, again, weren't calling like to change appointments or anything like that. The calls were really just focused on any interested new patients. So it was nice again to just have that continuity while I was on leave and I actually took almost 6 months off. So it was nice to have, that piece covered for me, and they could still text me or message me, if something came up that they had a quick question on or something. It was very limited need for it, but it was there if the case arose again where patients were calling who were in particular like new patients or current patients were wanting to check in when I was going to be back and make sure they could schedule or something like that. It was again really nice to have them basically be able to take care of that for me, and I didn't need to worry about it.
It's great. And most of our competitors, you pay for bundles and you don't use the bundles. With us, it's just we just want to be able to grow with you. We want to be able to stay, sort of relative to your income and not be too much or too little. We got to keep our lights on as well, but we want to make sure you keep your lights on. So that's part of our structure. There's one other thing that stood out, that you haven't found anything else that you would rather use, and I think you were saying mostly because of how we're familiar with your practice and your type of practice. Anything you would say about that?
Yeah, I would just reiterate what I was saying before about having a service that is familiar specifically with naturopathic medicine is really important to me again because I want people to be able to have an understanding after they get off the phone about what I do and who I am and what it means to work with a naturopathic doctor is really important because I think that's what sets us apart. We're not your average doctors. We really take a lot of time with our patients. We really try to understand the root causes of what's going on for them. It's a very, again, sort of niche type of practice. And I think it's important that people come away with an understanding of that after they call your business or call your practice. So to me, having this service is invaluable in that sense because it's not like just having a random person answer your phone who doesn't really get what you do. It's important to have someone with an understanding of naturopathic medicine answering your phones.
Awesome. And finally, you mentioned you were happy to recommend HPM, plan to refer people our way. Maybe you could just tell us your thoughts on that.
Yeah, definitely. Like I mentioned, I've had definitely a number of colleagues reach out over the years about just different business questions and sort of looking for advice in that sense, or people who might be deciding to open their own practice, kind of wondering like, how did I do it? And so, I definitely mentioned the tools that I utilize as being one of them that can, again, really be helpful in a way to, have people answering your phone to know what you do, but also that it's a reasonably priced tool to utilize that's not going to break the bank, where you might not want to hire a full-time front desk staff initially, right? When you're trying to keep costs down, when you're going out into business. So, yeah. So I think just because some of my colleagues sort of know me as a business minded type person in some sense that they'll sometimes ask my opinion on how to do things or how to start a practice, and really it's chipping away at all the check boxes you have to do to just get a business running, but figuring out how to have usually a phone situation going as part of that, and so forth, and have your lines of communication with the public be open and available and working.
It's great. Thank you so much, Dr. Casey. Just great to have you in our profession and great to have you working with our team. And thanks so much. Anything else you'd want to add before we finish up?
No, I don't think so. Just thank you for putting this tool out there for us. I appreciate it.
Glad to do it.